tell you how to do it all day. So
Right,
you have
you
to do it yourself.
exactly.
Just take your time. Ain't no rush.
CMPRadio.net. It's the station.
Welcome to CMPRadio.net studios live from beautiful Chester, Pennsylvania. Today the weather is a little warm outside. It just was a little dew on the grass. But we are live here in studio with OnePA. OnePA, everybody. Hey, do me a favor, guys, and just introduce yourselves. Tell the people where you're from. Why'd you join OnePA? Cool?
Yes. My name is Shahir, a.k.a. Denny Nick, born and raised in the city of Chester. Of course, I'm in education, but I joined OnePA because of the health situation. No matter how intelligent you are, health comes first. So after we conquer the health, then we'll go into education. But I joined them because they're involved with trying to better the citizens when it comes to health. When it comes to provision, Crozier Chester Medical Center was very convenient for the citizens of Chester. And in order to get service now, you have to go 20, 25 minutes away to get service. It's just that the hospital at one time was the best. And what was before shall be again.
No, that's good. Okay. Very good.
Hey, I'm Rubib Hassan. I'm the staff organizer here for Delaware County for One Pennsylvania. So I help with the logistics, help arranging meetings, Yeah, I got involved with One Pennsylvania because I think a lot of times in our lives there's forces over our head, that make decisions in our everyday lives that we don't have control over. Mainly like wealthy people, government making decisions without input from the people, and it affects how we live our everyday lives. So OnePA, what we try to do is we try to empower the community, give them the tools necessary to speak to what they need to better their lives. And today what we're talking about specifically is a hospital closure. Crozier and also, the several ones that are going around in Delaware County with what's going on with our healthcare system.
Miss Lady?
Good morning. My name is Keisha, and I am here with OnePA to speak truth to power. We are a group trying to change the trajectory of the life in Chester. So I'm recently here. So I'm not a long stay as some of you.
Okay, well, I appreciate that. And today's episode or interview's title comes from their flyer. Healthcare is not a hustle. What does that mean to you? The campaign is that's the campaign title, correct?
Yes.
What does that mean to you?
So when we say that healthcare is not a hustle, we expect those that are in power to consider the people that are needing the care. So we don't want it just to be a hustle for someone to come in again to leave and take the resources, and we're left without a hospital. So this is not a hustle. This is people. These are people's lives, and the healthcare is important to the health and the well-being of the people of this community.
Okay, why do you guys think that is such a big deal, the healthcare system? And you being from the city of Chester, Mr. Shahid, give us Shahir, I'm sorry.
That's okay.
Give us a little insight on why it's so important to have a hospital here.
It's relevant to have a hospital here. First of all, I'm disabled. I'm on a walker. So my doctors, someone was at Crozier, and if I couldn't get a ride, I was able to walk to the hospital. So that comes to convenience. It also comes to having what's this balance and proper. We are number one, and we should have the number one emergency ward. We had the number one burn center. We should have the number one trauma center. Because we are number one, it is relevant that we have the number one things. And that's why I believe it's necessary to have it for convenience, as well as to present yourself as to prove who you are. You're number one. Now it's time to prove why we're number one.
Okay. Any other insights?
Yeah, why is the hospital help important for Delaware County? Well, yeah, so
Specifically for Chester.
for Chester, yeah. So, you know, being right off of like 95, being that this is like an area where a lot of like working people are, the hospital was a huge institution in the community. It provided a lot of jobs. Like Shah was saying, people with disabilities could have an easy access to health care. And yeah, so and now, you know, talking about healthcare is a hustle. It's like you have what's happening right now in our healthcare systems is like there's wealthy individuals, they're private equity, real estate, you know, whatever you want to call it, and they're coming in and they're making decisions about how our hospitals are being run. And that's what happened the first place with Prospect Medical Holdings. You had this wealthy private equity company in California coming in, buying the hospital, Crozier, which was struggling, and then treating it like a business rather than what it should be, public service. You see the same thing happening with the Postal Service, right? Amazon's coming in, taking it over, employing a lot of people, you know, fighting unions, right? It's about control over our services and our community. In this case, the hospital. Yeah.
And could I touch on one asset that the hospital here has that Temple doesn't have? There's 80 acres of land. So you have the ability to the burn center, other things that you could put there that are accessible that you don't have to find area to build on. The land is there.
Yeah, I think the shutdown of Crozier, it impacted a lot of people. My mom specifically used to go to Crozier. She was in Woodland, PA, like right down here. Mm-hmm. And Crozier was the closest hospital for her to go to. And my mom was sickly for a little bit of time in her life. She's healthy now. She had vertigo.
That was good.
And I don't know if you guys know what that is, but it's kind of like you lose your balance, you pass out, those kind of things. She was at work and couldn't get to a hospital, so they sent her to an urgent care. And urgent care said, oh, we did all that we could do.
Right.
Pretty much go home. And later then she was hospitalized for that, just not close enough to home, right? I think about being in emergency rooms outside of this space here. Specifically, we were at the new Aston Urgent Care where they have, or Christiana Care, I'm sorry, where they have an emergency room with limited beds. There's no spaces for people to stay overnight unless it's inside of the emergency room. And we met a nurse there. And I asked her, I said, how long you been doing this? Oh, I've been doing it for 30 years. 30 years? Oh, that's great. You've been here. Obviously, she couldn't be there for 30 years. I said, so what hospital did you come from? Oh, she said, I came from Crozier when the shutdown happened. And she told me how many people were affected as far as employees go. But if you think about the effect of the employee, you have to think about the effect of the families that the employees have in those spaces. But then outside of that, each and every resident, not only in Chester, Pennsylvania, but in Delco, period. I think it's somewhere around the number, it's close to 1 million people that live in Delco, from Upper Delco to Lower Delco and everywhere in between. And I think about how hard that is for the trauma. Gunshot victims having to be transferred anywhere in Pennsylvania or in Philadelphia, I'm sorry. Presbyterian, Mercy is down there, Lincoln, which is off of Lancaster Avenue in West Philadelphia. That's
A distance.
it's hard. If I get shot in a major artery and I could be taken 2 minutes up the road because it was open, I have a better chance of living than I do if I have to be taken 20, 25 minutes away. So I think that is very important that we bring the hospital back.
Yes.
Well, we bring the hospital back as a nonprofit because, like you guys were speaking of, it shouldn't be a business for profit. It should be a business to help and serve the community. And I think serving the community is so far-fetched to people because we have instances where we should be protecting and serving, but we're playing hide and seek. And I won't go too far into depth of what that looks like. But I just wanted you to know that I'm 100% behind the campaign, the idea of OnePA and what you guys stand for. I appreciate your time for coming out, hanging out with a guy like me today, just to discuss what this looks like and bring awareness to, one, the city of Chester so that they can get behind you as well, as you guys have a petition that needs to be signed so that you can push the agenda of bringing the hospital back as a nonprofit. If at the end you want to share where they can find that, we can do that. If in the middle of this conversation you want to talk about where they can find it, we can do that too. It's open range. You know what I'm saying? So let's go in. So the first question I got for you guys is, what specific healthcare crisis or hospital closures led to the creation of this petition? Would it just be Crozier? Would it be Delaware County's hospital? Would it be Springfield Hospital, Taylor Hospital?
I mean, I guess it originated from Crozier. Autumn, who is an organizer with the chapter, what she did, we came into Chester, we knocked on thousands of doors. I think we had a few thousand conversations, and we asked people, like, what do you want to see? What are the challenges that you face in your everyday lives, and what would you like to see changed? And obviously, you know, the incinerator came up, and also the hospital came up, because Crozier just recently closed down. So, you know, you have Crozier closing down, but at the same time, you have Taylor, Springfield, Memorial. So specifically, we're trying to address what's going on with Crozier, but this is that's like the big picture, right? There's like multiple hospitals closing down.
Okay.
What we see as citizens is that people in power sit back and watch this hospital decay. They sit there and they watched it go down. I remember back in 2017, my son was shot, and they had to lift him to a trauma center in Children's Hospital in Philadelphia. So this didn't occur overnight. We see that people want our land. It's just some, I'll go with the William Penn. It's a great place in the world to live when it comes to storms and floods and tornadoes and hurricanes. So the area itself is, people of finances want this area. It's all about the land. We want this land for people with money. So all you poor people, Get your heads together. Realize if you're going to want this land, then don't exclusively exclude us. Include us. You don't have the riverfront. We see how you building. And if it was up to you, you're trying to buy our houses. I live in the Martin Luther King homes, and you come to me, well, you want to sell your house? I'm not trying to sell my house. I want to be a part of this development that's coming. Mm-hmm. It's not that the city of Chester's going anywhere. They only want people out of the way. And I'm not just talking about African Americans. I'm talking about poor people. They want you out the way so they can come in and say, this is our, like it used to be in 16, 17, 1800s. And we know who used to have it. Okay. But now you're in a place where there's 33,000 people. And I'm just talking about Chester, but when you start talking about Marcus Hook and Trainer in the Delaware County, there's 570,000 people that are all affected by what happens down in Chester. And you just don't, it's just that you want Sharon Hill, you want it all back. And it was yours, I do admit. But wealthy people is in here and they're saying, hey, we can sit back and watch your hospital collapse. And we have enough money to bring it up anytime we want. And we have to have our heads involved so we can be involved with the change that is coming with or without us.
So I think something, too, that Shaw's getting at here is, like, we want to be, like, involved in the development process of the hospital. You know, the community needs input, and we need transparency around what's going on. There's some kind of advisory board that meets with the hospital owner, Yoel Pollack of Chariot Equities. And as OnePA, we asked if we could be on that board, to represent just like regular people, right? And we were told, no, you can only elected officials are allowed on this board. But, what does that say, right? Why can't you have an organization that represents just regular working everyday people?